We are live, and Dana
Yay.
will be doing the introductions.
Yes, well, I am so excited about tonight. First of all, hi, Dr. Stephen Phillips, my partner
Hi,
here.
Gypsy Doctor Dana Parrish.
Good to see you. We are super, super thrilled to honor our only guest of the evening. He is a rock star scientist, doctor, best-selling author. So let me read you a little bit of his bio, and there's kind of nothing that you have not done at the highest level. It's absolutely amazing. Dr. William Li is a world-renowned physician, scientist, speaker, the author of the New York Times bestseller, Eat to Beat Disease, The New Science of How Your Body Can Heal Itself. His book is seriously amazing. He is best known for leading the Angiogenesis Foundation. His groundbreaking work impacted more than 70 diseases, including cancer, diabetes, blindness, heart disease, and obesity. His TED Talk, Can We Eat to Starve Cancer? Also, honestly, one of my personal favorites, has garnered more than 11 million views. He's also the author of over 100 scientific publications in leading medical journals such as Science, New England Journal of Medicine, The Lancet. Dr. Li has served on the faculties of Harvard Medical School, Tufts University, and Dartmouth Medical School. Welcome to the Dana and Steve show. Thank you, Dr. Li.
Thank you. It's a real pleasure to be here, and I'm honored to speak to two such amazing authors. I really like your book, The Chronic.
Thank you. So I'll start off the questions if I can. You and your team, your research team, were among the first people, if not the first people, to discover that one of the main pathogenic mechanisms of COVID was clotting. Could you just tell us how that began and what the ramifications have been?
Yeah, well, first of all, I'm an internal medicine doctor, and although I've taken care of infections, throughout my career, I never really thought that, and I don't think, of course, anybody on the planet thought that we'd actually have to contend with a pandemic in 2020. But during the lockdown, I realized that the reason that the frontline workers were flailing in the emergency room and in the intensive care units is because we had almost no real knowledge about this disease of COVID-19. The idea of a respiratory infection is pretty simple. You breathe it in, it infects your airways, you get a lung infection, and hopefully you get better. And in fact, most people do get better, but so many people are getting worse in the lungs and getting intubated and on a ventilator. And, we saw all these horrible pictures. But there was something more to me that I noticed, which is that we had these phenomena in our patients that we didn't understand. Strokes, heart problems, kidney problems, COVID toe, things that you wouldn't normally expect with garden variety respiratory infections. So I thought I could do two things. I could either suit up and go down to the hospital downtown and try to help bail out, my fellow workers, or I could actually try to use my research background to try to solve the mystery. And I love a good detective story, and so I chose that. And what we did is we actually got autopsy tissue of people who had unfortunately died of COVID. And then I assembled a group of people from Belgium, Switzerland, Germany, and the US. And we dove into the deep end of the pool, the research pool, to figure out what was going on. And here, I'll tell you what we found. We found that this coronavirus caused a bad lung infection. That wasn't a surprise. But the thing that made our jaws drop is we saw for the first time, and this was March, April of 2020, we saw for the first time the coronavirus, that little ball with the spikes coming out of it. We saw it infecting the blood vessels, the lining of the blood cells lining the blood vessels, the endothelial cells in the lung, and destroying, trashing the vasculature, the blood vessels. And what we were able to do by visualizing the virus, looking at the ultrastructure. Now we're talking about, 10,000 magnification. It's like shrinking yourself down to be a microscope and a microscopic size and seeing this thing. We suddenly understood why blood clots were happening, because the blood vessels were damaged. And if they were damaged in the lung, we also looked at the brain, the heart, the lymph nodes, we looked at the testicles, same kind of thing. It was really amazing to see this respiratory virus causing a vascular disease.
Wow.
Yeah, and you have some amazing scans as well, right? showing that the blood vessels in the lungs have been destroyed. Can you tell us a little bit about that? It's pretty chilling to realize how much damage is actually done.
Yeah, well, so in the very beginning, we were able to do this, use this technique, research technique. Again, that what I, of the many terrible things that we all had to experience in the last year, there have been some bright spots that I think we've all seen. One of the bright spots for me was watching the research community pull together. No matter what any researcher was doing, pretty much they dropped their projects and they all kind of converged. We all sort of figured out what can we do together to figure this out. So one of the things we did is we were able to take the lung tissue with the damaged blood vessels and inject the blood vessels in the tissue with a resin that filled up the blood vessels. So think about kind of injecting molten wax into a die and into a cast, and you get the cast of a blood vessel, and then you can dissolve out all the other tissue. And then we were able to spray it with gold and then put it under a scanning electron micrograph. And literally you rotate it. It's like a 3D printer in reverse. You're not printing anything. You're just photographing it as it's rotating in 3D. And then you can see this beautiful picture of normal, healthy blood vessels, which look like lace, like your grandmother's lace. And that's normal, healthy lung. But if you were to take a look at the people with COVID, it didn't look like lace. It literally looked like you took a flamethrower and you burned that lace and it just completely fried it. And that we published that as a lead article in the New England Journal of Medicine in the spring, and it opened the door for everybody to kind of say, we had no idea this kind of damage was going on. And this has really led us subsequently, from looking at those pictures and seeing what was happening, to not just for people who died of COVID, but survivors of COVID. We've now started to take a look at people who are still having shortness of breath 6 or 9 months later, a year later, and we're finding some similar findings in living people. Their lungs or their blood vessels are also damaged.
I was going to ask you about that. I mean, does everybody who has contracted COVID, do you think they all have some kind of damage? Is there always some kind of wreckage left behind? Maybe, I know we can't answer about everybody, but do you think it's a really big percentage?
So the idea of having COVID, survive COVID, and then carrying that damage, I call it the long tail of this disease, is a big mystery that we're trying to solve. Because as we all know, there are people that do get infected and they aren't even sick. They're the asymptomatic people. And there are people who do get infected, they get a little sick and they bounce right back. And then there are people who really go down the tubes and never recover. So, that's not what we normally see with diseases. I mean, I think that, Stephen, we're taking a look at somebody with heart disease or diabetes. It's a pretty predictable path of what they're going to do for the most part, But here it really is kind of like a kaleidoscope of what actually happens to the patients. In terms of the people who, do we know if blood vessel damage occurs in everybody? Actually, we don't. We don't even have a good marker. There's no test that actually allows us to really reliably do this. This is the brand new disease for humans. And so we know so little. And I think the other thing, to do good research, I mean, I'm speaking as a scientist, putting my scientist hat on, to be a good researcher, the first rule of thumb is to actually have a slice of humble pie.
Right.
You have to have humility to say, we want to answer this question because we don't know the answer.
To be a good doctor, you have to have that too. And it's a rarity, I find, in our field sometimes. Well, you're an amazing researcher, and you have such a focus in angiogenesis, which is a term that some people are familiar with and other people aren't. Can you explain angiogenesis? And it's fascinating. It's very much related to my other pet topic, mTOR and autophagy, which are other high-tech things. We'll get to those in a second. But can we start with that? Because I think it's so important.
Right. Well, angiogenesis sounds like a complicated word, but it's really simple. 2 parts: angio, blood vessels. Genesis is how they grow. And so angiogenesis is how our body controls the growth of blood vessels. And our blood vessels are really our circulation. And the reason that it's an amazing area to study and how I got into it is because most people don't know that our circulation, we've got 60,000 miles worth of blood vessels that are packed inside our bodies. And this network actually brings oxygen and nutrients. Whatever we eat, whatever we breathe, gets carried through these blood vessels. Every cell, every organ is fed by our circulation. And so it's one of the most important defense systems for health that we actually have. And what's amazing about angiogenesis is that our body has the ability to actually maintain just the right number of blood vessels, not too many, not too few. In fact, I call it the Goldilocks zone of blood vessels, like not too hot, not too cold, not too hard, not too soft, just the right amount. Because we know if you don't have enough blood vessels in your body, your organs starve and your wounds won't heal, your heart will have a heart attack, your brain after a stroke will die. And on the other hand, if you have too many blood vessels, it causes problems because they tend to not be normal. And so you can have blood vessels growing where they don't belong in your eye for vision loss, for macular degeneration or diabetic retinopathy, a complication of diabetes. Or even more sobering is what happens when tiny little microscopic cancers that we all develop in our body that never become dangerous until they are able to hijack our circulation and they grow blood vessels selfishly to feed themselves. And I was part of a laboratory where the pioneer of angiogenesis, Dr. Judah Folkman, was my mentor, and we saw amazing things. So if you actually took a tiny little tumor, microscopic tumor, the size of the tip of a ballpoint pen, and you prevented blood vessels from ever touching it, that's all, it would just stay there until it actually kind of just, the cells just go away. They die because cells don't live forever. But if you actually allow blood vessels to creep up and touch the tumors, those tiny microscopic cancers, it's amazing. The cancer would explode in growth, but once they're fed, and in fact, we saw cancers grow 16,000 times in size in just 2 weeks. And so angiogenesis out of control is like a trigger for cancer growth. And that really wound up becoming one of the areas that I got involved with. How do we actually starve cancer by cutting off its blood supply?
How do you do it?
Well, when I started 25 years ago, there were no ways of doing it. So we were discovering things from the natural world. We were looking at funguses. We were looking at fungi. We were looking at small molecule drugs, including mTOR inhibitors. We were looking at different antibodies to neutralize things. I mean, it's hard to recall for many of us who, look at all the fancy drugs we have now. 20 years ago, it was like the Stone Age compared to where we are actually now, biotech-wise. But we were finding all kinds of things that would interrupt tumor blood flow. And ultimately now there's over a dozen drugs, biotech drugs that are actually used to treat cancer. They're FDA approved for anti-angiogenesis against cancer. But what I got interested in about 10 years ago was, as a doctor, I was seeing all these patients and giving them really dire diagnoses and either telling them to go to a specialist or writing prescriptions and sending them out the door. And I noticed something really odd, and Stephen, you might have this in your clinic as well, but my patients would be very polite. They'd put on their jacket, they'd leave, thank me and leave, and then they would pop their head back and say, hey, wait a minute, one more thing. What can I do for myself? Is there something besides the prescription? Like, what should I be eating?
Right.
And I realized that although I had answers to a lot of their questions, that was something I was never taught in medical school or residency training or after residency training. And I thought that was wrong because I had a lot of science on my side, but I realized that I had never been taught the science of nutrition. So that's when I went back to begin looking at foods that could actually activate your body's defenses, including starving cancer.
So can we talk about some of the most potent angiogenesis inhibitors that we find in foods?
Yeah, well, most of these naturally occurring angiogenesis inhibitors, and there are probably tens of thousands of them, but we probably have a good 200 that we've been discovered so far, like over the decade or so. They've all been tested in the same systems that drugs are developed. And so that's kind of my street cred here, is that, like, I'm not one of these people that just eschewed and said, forget about modern medicine, let's go eat kale and wave that kale frond around. I'm like the dude that actually am still developing modern biotech medicines. But what I was able to do is to figure out how to actually test foods in these same systems that we use for drug development. So I'm going to tell you some of those natural compounds in a second, but it's really important to understand that we're able to actually break down foods into components that we can test. Because, if you're a cancer researcher, you can go online, clickety-click, find a chemo drug and have it overnighted by FedEx, have a powder the next day, take a scoop of it, put it into your lab experiment, and you'd know within a few hours or a few days if it treats cancer. You pick up the phone and call a pizza delivered in 15 minutes, and you ask that cancer researcher to say, will the peppers work? Will the mushrooms work? What's the effect of olives or cheese? And nobody knows how to do that. And so that's really what I set out to do, is to figure out how do you take whole foods, break them down into the component parts, and then discover what are those potent factors. So let's go through a couple of them. One of the most potent foods, it's actually a beverage that we actually encounter that is anti-angiogenic, cancer starving, is tea, green tea. And we know that there are catechins. These are, polyphenols that are found in the tea leaves, that when you steep the tea, they come out into the liquid and we drink it. That those polyphenols actually are very, very powerful inhibitors of angiogenesis. They do a lot of other things too. They decrease inflammation, they help to regulate your metabolism, they decrease your blood cholesterol. But if you were to put the lens of starving cancer, you would see that the polyphenols in green tea, one of them, EGCG, epicatechin 3 gallate, actually is a really powerful cancer starver. But how do you then develop the research? Because that's just in the lab, right? That's a chemical analysis. You want to test it in the same way we need to test if you're going to develop a new medicine. You have to look at it in cells to understand what it does to the cell. You want to look at it in animal models in the laboratory to see, is it safe for the animal? And is that actually going to do what we want it to do, starve cancer in the animal? Then you want to see what happens in people. Small studies, small case studies, small clinical trials. But what's nice about food that we really can't do easily with drugs is we can study food in hundreds of people, thousands of people, tens or hundreds of thousands of people in public health epidemiological studies. And when you take all of that evidence, for example, you see that this EGCG in green tea is a powerful actor to be able to inhibit angiogenesis, not only in the lab, but in people as well. So green tea, tomatoes have lycopene, which will also have that type of effect. And soy, there's an urban legend that soy is dangerous for women because it might spark breast cancer. Urban legend. Study of 5,000 women showed that actually if you, that those women who already have breast cancer, the more soy they ate, the lower their mortality. So completely the opposite of what you would think.
And male patients frequently ask me about soy, and they're concerned that they'll get gynecomastia or some type of feminization or something. So could you just comment on that, because I want to make sure that that's accurate information.
Well, listen. Well, let's take a look at where there's when it comes to food, especially, there's a lot of urban legends that exist. And one of the things that I have a vendetta against misinformation, like that to me, when it comes to food, if there is science, let's put it out there. And it's only what we know now. We'll put more out there when it comes available. But I think that what's important is to clear up the air. So here's basically what it is. Soy foods that come from soybeans do have a molecule, a substance in it, a chemical that is a plant estrogen, a phytoestrogen plant. And the way this urban legend came about is that some human breast cancers are also sensitive to human estrogens. And so in a well-intentioned person, said, well, the plant has estrogen. If plant estrogen is a human estrogen, let's keep away from the plant. So there's no problem with understanding how the theory might come about. But if you're a chemist or a scientist, you look at the phytoestrogen chemical structure, and then you look at human estrogen, you see that they don't look anything alike. All right. The two chemicals look nothing alike. And in fact, then if you're a cell biologist, you realize that the plant estrogen blocks the human estrogen at the level of the human cell. So in fact, what's in soy is like Mother Nature's tamoxifen, which is what we use to treat breast cancer. And on top of blocking human estrogen, which it would do in males as well as in females, so will not cause gynecomastia or what we manage, right? But in fact, the other fringe benefit of these phytoestrogens in soy is that it will actually also cut off the blood supply, feeding cancers. And so this is another reason why if you feed, if you actually eat a lot of soy, we know that it cuts down the blood vessels that might be feeding breast cancers.
Okay, you just blew my mind.
It sounds like such a fine balance, between angiogenesis and angiogenesis inhibition and this Goldilocks zone, like you talk about. And like I had read that it was a double-edged sword so many times when I've looked into this, and particularly even with atherosclerotic disease, that angiogenesis actually feeds the initial process of the thickening of the wall and all the inflammation that goes on in the wall of the artery itself. So could you comment on that? Because I have a family history of heart disease, and these are important topics for so many so many people that are watching us.
Right. Well, when I was starting in the field, there were two camps: people that were studying diseases that didn't have enough blood vessels, and they wanted to grow angiogenic vessels, like in the heart. And I'll come back to that in a second, but with the caveat you mentioned. And then there were people that were studying cancer and eye disease, where there are too many blood vessels, the other side of the equation. So either they were trying to fertilize the garden to try to grow more flowers or more grass, or they were trying to mow the lawn to prevent those extra blood vessels that weren't there. But the Goldilocks zone, as it turns out, is it is a fine line, but the line is pretty thick. It's a lot thicker than we thought. And so the body knows automatically how to grow what it needs to, but it also mows the lawn by itself. So you'll never get more blood vessels than you need naturally in healthy circumstances. All right. Now, what happens when your angiogenesis system isn't able to maintain that Goldilocks zone? Well, you might not be able to grow enough blood vessels in the heart muscle. So you wind up actually having cardiac tissue, heart tissue that isn't as vibrant, or muscles that are actually weaker. Okay. But now you asked, you came up with a very subtle point. And I'll try to explain this in a way that all your viewers can actually get this. When you hear about atherosclerosis or blockage of the arteries, everybody thinks that's like pouring bacon grease down the sink and it just clogs the sink. Not really quite that way. What actually happens is that there are cells that accumulate in the wall of the blood vessel. It's not just fat. There are actually cells that actually grow that blockage, and so those cells and the lipid layer, the fatty layer that grows there, as that area gets bigger and bigger, it also requires a blood supply. So there are blood vessels that are feeding the disease tissue, just like a cancer. And in fact, the heart attacks, that occur. You remember, Stephen, the so-called widow makers, right? They're the sudden heart attack that drops somebody eating breakfast in the morning and you can't get them back. They're due to blood vessels that have actually grown so intensively in the plaque in the wall of the blood vessel that they crack the plaque. So it's kind of like, when your freezer over freezes, you've got all this ice there. When you crack it with a screwdriver or something, or a knife, all of a sudden the whole piece falls off. And that's what can happen when there's too many blood vessels. The plaque becomes fragile. And when it cracks open, it just slams shut like a trapdoor and you get a heart attack. And so absolutely, in that particular instance, the question you want to ask is, well, do we want more blood vessels or less blood vessels? The issue is that we want to get the body, long before you're in trouble like that, to be able to maintain that Goldilocks zone, because at that point you're chasing disease as opposed to maintaining health.
Mm-hmm. Right. So is there a best way to kind of minimize the angiogenesis that goes on in the wall of the vessels and maximize the angiogenesis that we all need in the muscle of the heart? Or is it really
we're still figuring a lot of those details out, but I would tell you, from the time we're young all the way until our last breath, we have a responsibility in making good choices to keep the lining of our blood vessels healthy. Those cells are called endothelial cells, and they're lining the inside of our blood vessels. And as long as those cells are healthy, and diet is a great way, exercise, diet, lowering stress are all great ways to be able to keep that lining healthy. They will, it will be harder and harder for the plaque to grow in that wall. And one of the interesting things is, my friend and colleague, Dean Ornish, was one of the first to show, but now other people have done it as well. That plaque that, when I was in medical school, we always thought you could never reverse the plaque. You have to just carve it away or put a jackhammer on it or stent it. Mm-hmm. You can actually reverse plaque formation, which to me is really astounding. You can use your body's defenses to kind of chip away and more naturally kind of reverse those plaques. But it really does require kind of a heightened sense of awareness, a commitment to actually, and make good choices, I guess, is really, at the end of the day, isn't that what life, our fates are, right? In terms of life, is how do we make the best choices possible?
Yeah. Wow.
I have so many questions, but Dana, I don't want to take away from your questions.
I wish we had like a 5 hour seminar with you, because there is so much. I do want to actually talk about, you do have a class coming up, and I want to talk about that before we end tonight. But can we go back to COVID a little bit, because you are really, I know we don't want to say, experts, because nobody's really an expert, but I think of you as a super expert on COVID. And what do you think is driving long COVID? What are some of the secrets that you've learned? We talked a few minutes before this, and I think people just don't know there's so much misinformation out there.
Yeah. Well, anytime you have a serious virus infection, even when you bounce back, most people don't realize that you're left with a little bit of kind of a black eye, so to speak. And so it usually takes us longer to kind of bounce back. We call this a post-viral syndrome. And Steve is an expert in this area when it comes to infectious disease. And so we're actually used to, in medicine, having a serious virus infection and having a little bit of paying for it a little bit downstream, but usually you kind of recover. We also know that if you're seriously sick and you have to go to the ICU in a hospital, man, it takes a long time to kind of bounce back from that. But what we're seeing with long COVID, or the people who have this, are the people who survive COVID, and then many months later, weeks to months later, even a year later now, we're finding they have this odd constellation of brain fog, racing heart, muscle weakness, ringing in the ears. I mean, you name it, it's all over the map. There's 100 different symptoms, more than 100. This is far outside of the norm in terms of what you'd expect with a post-viral syndrome. And so that's why it's gotten a new name. The people call themselves long haulers. Right. In the beginning, we called it long COVID. And now the NIH, the National Institutes of Health, have given it a name. Of course, when doctors give things names, they got to make it more complicated, but they call it PASC, right. PASC. Post-acute sequelae of COVID. Just all that means is that after you got over the first thing, you wind up having to deal with all these other things. But a name doesn't actually capture it. We don't really understand what is actually going on. But here's what we actually do know. We know that you still have blood vessel damage in some people. For example, I've been able to do research on people who have recovered from COVID 9 months ago. But they still are short of breath, and their x-rays look fine, their chest x-rays look fine, their CAT scans of their chest look fine. When you examine them as a doctor, their lungs sound perfectly fine. So they should have no reason to have shortness of breath. And, this is the kind of frustration that people with the long-term tick-borne illnesses also have, which is, look, I know I'm not feeling well. I know I'm not sick, but the doctor says, well, I can't find anything. So, maybe it's in your head. And this is when I stepped in. Many patients were saying, Doc, I'm telling you, I can't breathe. And all of my other doctors are saying that there's nothing wrong with me. They're giving me, they're giving me, Prozac to actually take.
Right.
And to me, because of what I had seen earlier on with acute COVID, I wanted to dive deeper. And so we actually are able to actually take the CT scans, the CAT scans of their chests, people who have long COVID, who still can't breathe. And we can actually reconstruct the circulation, the blood vessels inside their lungs, and compare any individual patient to 1,000 normal, healthy people's lungs who we reconstructed. And then using artificial intelligence to be able to do all the calculations. And I've seen people who are still missing 30%, 50%, in one case, 80% of some of their blood vessels in their lungs.
How do they survive? I mean, how does he get by with 80% of his blood vessels gone, or she? I mean, that sounds ridiculous.
Yeah. Well, it's actually based on the size and segments of where the blood vessels are. So the 80% is like at a particular size of blood. The tiniest little blood vessels have been really smoked. And so what happens, of course, in the body is really amazing. It's got all these ways of bypassing and defending itself and figuring out a way around it. I call the body like when you pour water downhill, it's going to find a way to kind of go where it needs to go if you let it. And so you wind up having a lot of these blocked blood vessels, which can't bring air in, which is why they're short of breath. And then the blood shifts over to the bigger blood vessels, which are then really dilated, which then actually clogs up their lungs and makes them feel worse. And so we know that small blood vessels can be damaged in long COVID. We also know that we think it's an autoimmune phenomenon that is going on in some of these patients, accompanied by chronic inflammation, and I sort of see this as kind of like a smoldering fire. It's not the blaze of the forest fire that happens in acute COVID when people are really sick, but this is really kind of like after most of the fire is out, it's still dangerous because there's still smoldering embers that are around. We think that chronic inflammation, maybe autoimmunity is part of it. That's the second part. The third leg of the stool of long COVID seems to be a neuropathy or a problem of nerves, both the central nerves in the brain and the spinal cord, but also in the peripheral nerves. So in the fingers, people have tingling. And, the thing is that I've also taken care of a few people who wind up actually have had long-term complications from having a tick-borne illness. And I found it stunning how similarly complicated these long-term symptoms are. Hard to make sense of if you don't have experience with it. It's a little intimidating even as a doctor to confront it because the usual tests don't reveal the usual problems. And because there's no playbook that's out there, even if we want to help our patient, we're not sure yet of what to do. And so this is where, for me, with long COVID, we have to keep our eyes and ears wide open. We have to listen to our patients. We have to really think hard what might be going on. And then I think judiciously come up with ways that might be able to help them.
So can you comment on persistent infection of the virus in long COVID? Before we were talking about, you had some new data that it can actually hide out in the mouth. I mean, we're aware of hiding out in the GI tract and in the olfactory bulbs, and also the observation of long COVID patients having improved symptoms after vaccination for COVID.
Yeah, it's a really, this is another part of the mystery. This is, by the way, this virus, this disease, COVID-19, has had a surprise around every single corner that we've actually been to in the last year. I mean, as doctors and scientists, almost every time we look, there's another thing that is not quite what we were expecting, and in some cases really surprising and puzzling. So here's the thing, right? We all know that at the very beginning of the pandemic, we needed actually to have a test to know if we actually had the infection or not. It's like a strep test, right? You need to know if you have mono, you do a mono spot test. We didn't have that for a long time. Then we have it. And so now we have tests that can PCR that can actually tell us, or rapid antigen, that if you actually have the virus, and if you apply the test in the appropriate way, you can know if you don't have the virus or you've cleared the virus because you can't find any signs of it. Now, and so when you don't have the virus with a PCR test, you're pretty confident that you're negative, right? And that's how we clear people. That's how you clear somebody traveling across the state or getting onto an airplane. But here's the thing. We knew right from the beginning, and Stephen, you actually mentioned this, that even at the beginning of the pandemic, that even when people cleared their noses, they were still passing virus in their poop, in their stool, sometimes for weeks, and it was hiding out in their GI tract. But we're not sampling, we're not taking rectal samples. And so we knew that in the beginning. And then we started to realize that, there might be virus hiding out in other recesses as well. The dental community found that the virus can hide in the gums. So, the gingiva. And that was at the beginning, by the way. That was like in May, June, we realized that. Just last week, came a paper from the National Institutes of Health, I think the American Dental Association Foundation, a bunch of different groups all got together, and they actually conducted studies to show that, in fact, this virus does infect the cells of the mouth. It doesn't just hide. It's not like a pepper that, or a parsley leaf that's hiding your teeth. There are ACE receptors in the cells in our mouth that the bacteria invade, and they stay there. And so saliva winds up becoming an important thing to test as well. So now, what about all these people that actually test negative? They still feel sick. Are they long haulers? Meaning, is there some other disease that's going on? Or are they still infected? Or do they have damage from the first time that just never quite healed up yet? And the frightening possibility is that maybe there's some virus that's still hiding someplace in the body. And so a little bit of kind of light at the end of the tunnel with the virus that surprised me is that, again, as of last week, there was a study done by Survivor Corps, which is an advocacy group, that showed that 39% of the people, almost 40% of people with long haulers, severe long haulers, once they got the vaccine, of the COVID vaccine, their symptoms improved, in some cases, dramatically. So why would a vaccine actually make you feel better if you didn't have virus hiding out someplace?
Right.
And so, I was thinking, Stephen, of your work, and you talk about this in your book, of, the fact that you can have chronic infections that are hiding out and not easily detected, that can continuously cause problems. And that's something that we really need to work on. And I think that this is where, we need to take a brand new look at what we call the natural history of COVID-19. When does it begin? Who gets affected? How serious do you get? Who gets it worse? Who basically, it passes right over them? And then for the people who actually have this long tail, the long COVID, long haulers, why do they have it? And is it one condition, or maybe it's multiple conditions? There's three theories that are floating out there right now. Number one, there is hidden virus reservoirs that we can't detect using the usual tests. And so when you get a vaccine, you're jacking up your immune system, and that helps to wipe it out a little bit more. You're getting a little extra cleaning, a little extra scrubbing from your immune system, so you feel better. Is that what's going on? We don't know. Number two, maybe there's little viral particles, pieces of the virus that are still around these people with long haulers. And those pieces are enough to trigger your own immune system. So you have this autoimmune situation going on. And then when you get the virus, the vaccine, you're super jacking up your immune system. And now the cleanup crew comes out and cleans out those particles. And then you feel better. And, and the third thing is that, is really the unknown is like, well, there's something else going on that we just don't understand yet. More questions than answers.
Yeah, for sure. Do you find, or do you know of any research looking at the rates of heart attacks and strokes, and not only long COVID patients, but patients who've recovered from COVID, looking a year out? Are these people at risk once they've had COVID? You know?
It's too early to know. We are really just at the 1 year mark, and most of the research in the field has been looking at the infection itself. But just earlier today, I was talking to a former director of the National Cancer Institute about the fact that there are cancer organizations now that are actually asking that question that you just asked, which is in these people who experienced COVID and recovered from COVID, does it actually impact their underlying disease, whether it's cancer or heart disease? I mean, we do know, for example, that in some populations of people, and we heard this early on, it was the older people, it were people who had obesity, it was brown and black communities that seemed to suffer this. We don't know. I mean, those are the same people and communities, obviously, that often suffer more severe chronic disease to begin with. And so is there some extra vulnerability that we haven't figured out yet? That's all ahead. I think that, in the next few months, we're going to be really getting some clues that'll give us some of those answers.
That's a concern, because when I've heard you describe, just how trash the vasculature is, I can't imagine that there wouldn't be. I mean, I'm hoping that we have the ability to heal after these things, so there's not, but I am concerned, obviously. Yeah.
Yeah, I also help do wound healing in people who have diabetes and other vascular diseases. And we do know that, one of the things that happened to people who have been hospitalized with COVID, sometimes they're there for a long time, they develop these pressure sores, bed sores. And those bed sores are really difficult to heal. And the reports that have been coming back to me as a wound healing person is that these wounds are really having an even harder time healing because the quality of the circulation has been so compromised. So, I mean, we spent a lot of time talking about kind of the little known, unsung, kind of scary parts of COVID. And I think that, the upside of talking about this is that, there is this feeling out there now that, it's time to reopen and we don't need the masks anymore. And now I'm vaccinated, I'm fine. I think that it's the message that I would, want to be able to send is that, trust us, those of us who are doctors and scientists, that there's still a lot we don't know about this yet, and we're not at the end of this thing yet. We still need to be really careful, but there is a light at the end of the tunnel, and I think that the empowering thing that people like to hear is that, man, this thing could have been a heck of a lot worse if we didn't actually have the ability to be able to do the kind of research we have, improve the way we can take care of patients, diagnose and more quickly using tests. And now we actually have the vaccine. So as horrible as we experienced last year, I think that if it wasn't for modern science and modern technology and modern medicine, man, it could have been a lot worse.
Yeah, so it's hard to think of it in this way. When we go through such a horrible thing, like it could be worse, but it could always have been worse. Yes, it could absolutely have been. So Dana, do you have questions? You have better eyes than I do, and it's hard for me to always read them because it's the funniest thing. Me trying to read these questions is like a Mr. Magoo episode of a cartoon.
I'm going to put some, if it's okay, our viewers will definitely have questions for you. So if it's okay, but before we go on to that, if you don't mind, a quick follow-up. First of all, thank you for sharing all this incredible information. Steve and I, from the beginning, have been begging everybody that will listen to wear N95s if they could, or to stay out of the grocery store when they could. We've told them this was airborne since about the end of last February. We are so worried about people getting this, and we don't want them to relax. And I think the information, we want them to enjoy their life in whatever way they can, but we don't want people sharing indoor air at this point until we know that this really can be taken care of with vaccines and therapies. we're worried. And hearing this sobering information and what you're seeing on these scans and the vast vascular damage that's done to every organ, or can be, and it seems to have no rhyme or reason half the time, I think it's really important for people to understand this is not over because we are relieved that there are vaccines. I mean, it's just not done yet.
You're absolutely right about that. I think that the light at the end of the tunnel, it's still a long tunnel ahead, and I'm really concerned about the over exuberant enthusiasm for reopening. We're really not ready to get back to normal, and I know everybody wants to get back to normal, and it's been a year of deprivation. But we get, in order for us not to lose the ground that we have earned, hard-earned ground that we have, we can't pull back on the momentum of actually taking the right kind of precautions. But I do think there's another interesting story from the last year is that, Stephen and I are both doctors, and here's something that I found really sobering. We learned last year that hospitals and doctors are sometimes very limited in what they can actually do for patients in situations like this, unless they were really, really sick. And doctors and hospitals had no drugs, no treatments, nothing to offer. They basically just supported people who were on their way out when they were seriously ill. This was at the beginning. And so where was health being conducted? Well, one thing that we realized, and by the way, people didn't want to go to the hospital. People didn't want to go to the doctors. They were all sheltered in place.
Right.
And I think one of the things we learned, whether it became explicitly understood or not, is that, caring for our health, in other words, our health care, is part of self-care. And self-care isn't something you only do in the doctor's office, because in this case, the doctor's office wouldn't accept you or didn't have anything to offer. Right. We were able to do things for ourselves in our homes. And because I actually study food as medicine from the very beginning, one of the things that I actually realized is that there's an important opportunity to make good choices in terms of the food we ate. Because, by the way, what were we all doing if we had to go to the grocery store? We weren't just lounging and cruising the aisles. We were like a SWAT team. Yeah. You got your list, you dressed up, you zipped out there, grabbed your stuff, and you got out of Dodge, right? So it forced us to make more deliberate decisions. And then when we got home, what did we do? We got to know, and in some cases, fall back in love with our pantry, our stovetop, our kitchen counter. And so this was an opportunity, has been an opportunity, and I think it's going to continue to have resounding effects where people have learned to reconnect with food choices and making hopefully better food choices, because we can actually build up our own health defenses in ways that doctors and hospitals couldn't help over the last year.
That is important to know. And I really hope my mom is watching this. Mom, do you listen to Dr. Lee?
Yeah, lay off the Klondike bars, Hetty.
Lay off. My mom is a breast cancer survivor, and I am always on her, and so is Steve, about cleaning up her act, because my mom would just love to stay home and eat burgers and drink soda all day. So anyway, she's always getting in trouble whenever we have brilliant doctors on to talk to us about food and good health. So we have some questions, unless Steve, did you have anything to say before we start a couple of questions?
Yeah, I'm looking at some of the questions that are really great questions. There are a couple of questions about endothelial growth factor. So they're referring to vascular endothelial growth factor. Patients with Bartonella in particular can have elevated VEGF, vascular endothelial growth factor, and a lot of patients have heard of this. They don't really, some of them may or may not know what it means. And can you just comment on what vascular effects this could have long term if this remains elevated?
Right. Well, it's a really great question. So our body, in order to maintain that Goldilocks zone of blood vessels, uses a protein called vascular endothelial growth factor. The easy way to pronounce it is VEGF, VEGF. And it's kind of like a fertilizer for blood vessels. Our body makes it naturally, but sometimes in diseases, particularly inflammatory diseases, or some infectious diseases like Bartonella, there's a lot of VEGF or natural fertilizer that gets dumped where it shouldn't be. And what that does is it upsets the Goldilocks zone, and you could get extra blood vessels forming. Now, we know this happens in Bartonella. Actually, we don't really know if VEGF, vascular endothelial growth factor, this blood vessel fertilizer, is elevated in the blood of people who have COVID. We think it is, but we don't know yet because this is not a regular test that's actually done. What would be interesting, though, is that VEGF in the body tends to correlate with inflammation. You got a lot of inflammation going on, you got a lot of VEGF floating around. And, and by the way, VEGF is also cancers also exploit VEGF to grow their own blood supply. So it's kind of dangerous to have a ton of VEGF floating around. That's not something you want to do. So I think that this is another thing that we need to actually try to figure out, this whole idea of growth factors for blood vessels that can upset the Goldilocks zone, chronic inflammation, chronic infections, and then also cancer is another specter that we have to watch out for.
Yeah, because it just leads to another question, like how is the Goldilocks zone impacted by chronic infection and inflammation that the Lyme plus patients, frequently have? I think that that in Lyme disease, the chronic inflammation basically continuously puts pressure on that Goldilocks zone to have more blood vessels growing than should be there. And that tilts the balance, the garden, in a dangerous position, right? Because if all you're doing is pouring growth factors into your garden, fertilizing your garden, your flowers might grow a little bit better, like that'll look good for a little while, but then the weeds will start growing like crazy as well. Mm-hmm. And that overgrowth of that garden becomes kind of a dangerous kind of situation to have. And so and of course, I think everybody has come to accept the idea that chronic inflammation is bad for our health. It never lets our body kind of cool off back to achieve homeostasis or the balanced state that we want it to be. And whether you're talking about Alzheimer's, Parkinson's, whether you're talking about COPD or emphysema, whether you're talking about heart disease, diabetes, all these conditions wind up having some semblance of chronic inflammation. So we know that that's not good. And if you've got a chronic infection that's basically continuously pouring gasoline on the embers of a fire, it's something that we really need to try to figure out how to lower inflammation. And this is, by the way, where there's some interesting research being done on other inflammatory diseases like autoimmune diseases like lupus, also a chronic inflammatory and autoimmune disease, where people have looked at diet and they've looked at vitamin C, ascorbic acid, but not just as a pill or a supplement or an infusion. They've looked at dietary intake to see if people who actually have lupus, if there's any correlation between the amount of foods with vitamin C they ate and the lupus flares. And so there's a prefecture in Japan, an area in Japan called Miyagi, the Miyagi prefecture, where there's actually lupus clinics because there's a lot of lupus there. And because there's a lot of the cases that are there, they're able to actually study the cases really carefully. And they found that people who ate more foods containing vitamin C actually had lower levels of lupus flares. Wow. And so what are some of those foods? Strawberries, broccoli, citrus, red bell peppers, a lot of the fruits and vegetables, whole foods. And then they also did another study, and they also found similarly the high consumption of green tea, pretty high, like 4 to 6 cups, also would lower the incidence of the lupus flare in terms of inflammation. Huh. And so, I think that finding ways to lower inflammation. Now, look, you and I could write a prescription for a steroid, and you can achieve that. You can just pound down your inflammation really fast, but that may not be the
that's definitely not the only way, and it may not be the best way to actually achieve this.
Yeah.
Well,
Wow.
yeah, I think we can agree with that. And so I have noticed an uncannily low rate of cancer in my patients, knock wood a million times. And my patients are generally on long-term antimicrobials, and we use tetracycline class as the core of many of our treatments. And of course, it's an angiogenesis inhibitor. And I always wondered, are we getting a side benefit of these therapies? Because I've treated over 20,000 patients. It's the number one killer, cancer. I should be seeing so many patients with cancer. And I know my patients forever, some of them, or many of, they keep in touch. Even patients that get cured, I get Christmas cards from them. I think I would know. And I'm just seeing a very shockingly low rate of cancer. I see some, but I can count on one hand in the last couple of years how many cases I've seen. And I always wondered, I don't know, just something thinking out loud, but I just wonder if there's a side benefit.
Well, one of the things that I looked at is the fact that some medicines that were originally developed for one thing, like treating an infection, like you talk about tetracyclines, doxycycline, they wind up being rediscovered many years later to have a different effect on different disease. Even if the FDA and the drug company and the medical community focus in the beginning on infection, it turns out that, for example, doxycycline, the tetracycline class, you talked about them as angiogenesis inhibitors. Well, it turns out that more recent research actually found that there's something that's not connected to bacteria killing at all. But in fact, these tetracycline class of molecules, which, by the way, came originally from the natural world originally, actually prevent blood vessels that tumors are trying to grow into them from releasing enzymes that allow them blood vessels to drill their way to penetrate the tumor. And so they inhibit the proteases, and so the blood vessels can't grow. So doxycycline, which is really commonly used in the chronic infection setting, actually is a pretty powerful angiogenesis inhibitor. Here's another example. A common diabetes treatment, oral treatment, metformin, which is, really inexpensive, very common, given to kids as well as adults, pretty safe. I mean, really pretty safe. One of the safer drugs out there, actually does help your body use blood sugar more efficiently. That's why it was developed originally. But later research discovered that the way that this metformin works is it actually inhibits a pathway called mTOR, mTOR. And this is the cell signaling pathway. Think about it as an electrical circuit in your house, from the circuit breaker to your dining room chandelier. Okay, and that circuit can actually drive diseases, including cancer. And it turns out that metformin basically cuts that circuit. It's like a fuse box that turns off, that prevents that circuit from being connected. And so then the dining room chandelier, which would be, it's fine if it's a chandelier, but if it's a tumor, can't grow. And so metformin has been found incidentally in people who have been treated for using it for diabetes to lower the rate of cancer. So this is an example in another field with another disease of your observation.
Right, and doxycycline is an mTOR inhibitor as well. So it all comes around full circle. These side benefits to medications that you don't think that there will exist, but they do. So I don't know if you have a couple more questions in you, or we want to be so respectful of your time because we're very, very appreciative that you're here.
I'm ready to rock with you guys, so keep them coming.
Okay.
Okay. Well, would you mind telling us? There were 551 people watching last time I popped on Facebook. So while we have people's attention, I would love to talk for a minute about your course. And thank you so much for offering a discount to our viewers who enter the Chronic book. That is super generous of you, and it's a big discount. So can you talk about
listen, I one of the things that I realized after my book Eat to Beat Disease came out is that people had questions that I wasn't able to write about in my book, because the book, as you guys know, having done an amazing job of your own book, which I encourage, by the way, everybody needs to buy and read that book, because we all know somebody who's affected by chronic disease. And so for me, that's required reading. But I think you're going to find this as well. People will have questions, and I started being asked questions I couldn't write about in my book. And I realized, especially during the pandemic, what I wanted to be able to do is have an impact on as many people as I could possibly have, which is why I'm honored to be able to come on to speak to your community and your viewers. I want to tell people what I know that can empower them to help themselves. Now, look, I got a day job. I'm a researcher. I'm doing all this work. I'm trying to figure out how to overcome the pandemic. I'm still doing cancer research. But one of the things I'm very committed to doing is actually to help people change their own lives. It's not about me. It's about what you are able to do for yourself that can actually contribute to your own healthcare. And for that reason, I decided to create an online course. It's an Eat to Beat Disease course. It's not a companion to the book. It's the research that went into writing the book and then all the updated things. So it's a 4-week course. It's got videos. It's got live sessions with me. It's got workbooks. It's got lists of foods. But what I try to do is to help people understand, how do you actually translate all this stuff into really practical, everyday things? And I thought, you guys have such an amazingly committed group of people that are truly interested in health that, if they want to actually learn about the course, they can come to my website, drdrwilliamli.com, and they can learn about the book, the course. They can actually use a code, and the code is The Chronic Book. Same name as the Facebook group, The Chronic Book, and they'll get an exclusive discount from me. And so I just want everybody to be able to benefit and learn as much as they can.
Well, thank you. That's very, very nice for our viewers. That's great. I love the discount code. Very, very cool.
The Chronic Book. Yeah, no, that's fabulous. Thank you so much. Oh my gosh, we have like millions of questions. Do you want me to go back and see? I had a good.
I see one about stem cells, which I thought was interesting. Somebody's saying that she's getting stem cells to help heal from COVID. Huh. I don't know if she's having benefit from them. This is Amy Jo. But do you have an opinion on that? Well,
such an interesting topic, because I actually been involved with regenerative medicine involving stem cells for a long time. And one of the first things that we thought about when we saw the vascular damage, the blood vessel damages, whether or not we could actually use stem cell therapies to assist people in recovery. This is for acute COVID, and there have been some clinical trials that have actually started with it. I have heard anecdotally of some people that have gotten stem cells and reported pretty dramatic improvement. I have a patient who was in Florida who I've been working with and trying to get her back into shape. She was really in bad shape with long COVID, and she got stem cells, and remarkably, she got better. I mean, that's the only thing that I knew that she was that she had done that was different. So again, stem cells are kind of a tricky thing, but they make sense. We want to heal ourselves from the inside out. And what I actually talk about in my course as well is that there are foods that can actually mobilize our own stem cells. Some of them people are going to say, oh, that's amazing, like black tea. It turns out that not green, but black tea can actually mobilize stem cells. And our stem cells live in our bone marrow. But then the one food that everybody is happy to hear about is dark chocolate. It turns out 80% or higher, like real cacao, actually has been shown to mobilize stem cells, actually double the number of your stem cells over the course of a month if you actually eat a regular diet of dark chocolate. And how do we know that it actually works is because cardiologists have studied this in people who are in their 60s with heart disease. And when the only thing they did was either give a placebo or give hot chocolate made with dark chocolate, like really hot concentrated dark chocolate, and have them drink it twice a day, just a cup, 8 fluid ounces. And they measure at the beginning the stem cells in their bloodstream, and they measure after 30 days, they double the number of stem cells, and then they measure their blood flow. So there's a test called flow mediated dilation where they put a blood pressure cup on, blow it up, and then they use a little ultrasound probe to see how fast your circulation rebounds from the blood pressure cuff, right? So, when you pump up your blood pressure cuff, your arm gets a little numb. So how fast is do your blood vessels rebound after being squeezed? And they were actually able to double the recovery rate of the circulation. And the only thing they did with chocolate, and they actually correlated that with the stem cells that came out. So powerful stuff. I think that stem cells are so fascinating and so promising. I would say my only thought, to people watching this is just make sure that you check with your doctor and that you're doing your own due diligence and background research on the people offering stem cells, because there's a lot of shopping mall corner people. If they're,
Right.
if they're selling a bong and stem cells in the same location, probably not the place to go.
Yeah.
Oh, well, there goes my guy. What about aspirin?
but-
Oh, go ahead.
No, I was gonna say, how does white tea stack up? Because I usually carry white tea in the house. Is there any data on that? How it compares to green or black?
Yeah, so I'll tell you what I know about white tea, and it depends on what type of white tea it actually is. But in Asia, white tea refers to the tender shoots that come out during the spring that you pick before it gets into summer and before the tea winds up becoming older, more mature in the season.
Mhm.
And it's kind of like the little fledgling baby teas. And the reason that that's different, it's because it's got a lot of the polyphenols, but not as much caffeine,
Mhm.
because caffeine is one of Mother Nature's natural insecticides that when the tea grows up into the summer in these tropical areas and bugs are eating the tea leaves, that's when the caffeine gets actually made. So it's actually good for people who are not tolerant for caffeine.
Got it. Okay, interesting.
How important is aspirin with COVID?
Well, that's still being studied, but I tell anybody who has been diagnosed with a positive COVID test and feeling sick that they should take aspirin. Aspirin is one of these, I develop biotech drugs. I've been involved with that for a long time, but I'm a believer that it's the right medicine for the right person at the right time. And you don't kind of keep on doing it that way. If you can actually get somebody to come off their medication, that would be the preferred state. But aspirin happens to be one of those exceptions to the rule where, it originally comes from the bark of a tree, the cinchona tree. So it originally was a natural product, but it seems to be doing all kinds of different things. For me, I saw the blood clotting happening in COVID, and I realized that if you're sick with COVID acutely, the one thing you don't want to do is to be forming these blood clots. And taking an aspirin when you have a positive test, if it's safe for you to take aspirin, not everyone can take aspirin.
Right.
Is something that you might do while you're testing positive, or at least for the 10 to 14 days that's out there. There have been some clinical studies to show benefit in aspirin, and certainly in the hospital, they found that if you thin your blood, which is really what aspirin is able to help do, that can actually improve your recovery.
Is it just 181 milligram, like a baby aspirin, that I know you can't really give medical advice, but that you're giving your patients that call you and have day one of COVID?
Yeah, it's probably going to be higher than 81 milligrams, because if you really want to actually prevent acute blood clotting, you're going to have to go to probably the full strength of aspirin. But again, I'm not giving medical advice here.
Right.
And I think that the research studies are still being done. In this country, you can get aspirin in two doses. 81 milligrams is the baby aspirin. Then there's 325 is sort of the full test aspirin. I think it's important to mention here, aspirin does have its potential downsides as well. And we know that it can cause bleeding stomach ulcers. It's hard on the stomach. And so people who have really, really tender, delicate stomachs, who actually have had bleeding ulcers and other things in the past, it's not, you got to really be careful about that. So usually people take aspirin with some food.
Okay, great to know.
Okay. Well, this is great. Like I said, I don't want to overstay our welcome, Dana, because we
Yeah,
tend
I
to do
know.
that with people.
I know
We
there are
we
so
can
many
easily be here for 2 hours.
There are
You
so
know,
many questions. Should we just ask one more and let you go? People
sure.
want to know about fluvoxamine, and what do you think about that for COVID?
Okay.
Might be able to neutralize oxidative stress. Is that correct? Or
So, the fluvoxamine is an interesting thing because it's actually medicine that's actually used to treat depression. And psychiatrists were noticing that people who are on fluvoxamine seem to actually recover from their COVID in the early days a little bit faster. And again, it was all discovery, all observation. We were all Charles Darwin in the Beagle at the Galapagos, just seeing what was going on. Nobody really knew what was going on. But it turns out fluvoxamine is now in clinical trials, and it seems to have anti-inflammatory, anti-oxidative properties. It also seems to have an antiviral property as well, and be able to intercept the virus from binding to some of the cells. Uh, uh, Listen, I mean, I think we really, really need to figure out what medicines, especially the existing medicines, could be repurposed to actually fight COVID. Because here's how I think about it, and this is a great message because we spent so much time talking about COVID. We went from a year ago being blindsided by this super scary disease that affected every human on planet Earth, and we hadn't seen it before. And the big fear is that you would get it and you would die. Now, we saw that on television and it was out of control. But the reality is that most people who got infected, so many people got infected, that although the deaths were horrifying and tragic, most people did actually recover from those acute COVID. Not that many people died, but the specter of being seriously ill is still out there. I mean, to this day.
Oh yeah.
Here's the thing. Now we got vaccines. Now we've got 3 vaccines that have been approved as of March 2021. And there's probably another one that's about to be approved within the next few weeks. Yep. So we got at least 3. And there's all this debate. Should I get the mRNA? Should I get, they throw around the brands. By the way, this is like, it's amazing how people that had no idea what a Moderna was or a Pfizer or right. Johnson & Johnson, it's like second nature to talk about these things now. Right. But I tell people not to stress too much about what brand they're getting, because the numbers that are the clinical trials that are all in the media are really quite difficult for the average person to really interpret. So I try to simplify it. Simple, when it comes to health, simple is always better. I always say, get whatever vaccine you can, because all the vaccines that are available have a 100% effectiveness rate in preventing death. And to me, I'll sign up for that, because it takes me from that scare, that fear of death, into another realm. Now, if you get infected, you're not going to die. But man, do we need a fluvoxamine or an ivermectin or something that's out there, some medicine that we don't have to wait 10 years for, and that's the super expensive, something that we can actually take, a repurposed medicine, hopefully, that can help us get better if we were to get infected. And then the third, so that's the second milestone I think we're headed towards. We don't know what it is yet. And then the third part of it is if we can actually prevent, treat, or reverse long haulers, because if you can prevent death, then treat the infection, and then reverse long haulers, we've conquered it. We've licked this thing. Right. Yeah. I mean, then all of a sudden we're in a very different place. So for me, what I'm really committed to doing, I'm passionate about doing, is to find any ways to understand what's going on with this pandemic, and then to use any tool at our disposal. And this is where I think it's the analogy I give. It's like mixed martial arts. You don't stick to one style. You go for whatever actually is going to work to achieve victory here in the octagon. We've got to be able to win this cage fight against this virus. And if it's diet, let's go for it. If it's a supplement, let's go for it. If it's a repurposed drug, let's go for it. And if, listen, plenty of investors pumping money into drug companies. Let's hope that we're able to do as well with antivirals as we have with the vaccine, but it's going to take time. So get your vaccine, still be really careful you don't get infected, because we don't have the antiviral yet. And then, pay close attention. The best way not to get long haulers is not to get COVID.
Yes, thank you. That is the best advice. That is the best advice. And I'm going to bank on eventually a prophylaxis. I want to make sure that, if this thing is still circulating, we can take something to prevent it, that's safe and effective and cheap and available. Do you think that's on the horizon as well?
Yeah, absolutely. I mean, I'm very confident. We're pretty good at actually coming up with medicines. It takes time though, and that's where I think time is not on our side. We're racing against these variants and all these other kinds of things.
Yeah.
So we got to just be careful. The one piece of I like to learn from history because I think that the past informs the future.
Yeah.
And if you go back to 800 AD, a long time ago, when all these big gigantic pandemics, the Justinian plague, all these things that like wiped out huge amounts of people in Egypt, and even going further back in probably prehistory. The one thing that we've learned is that this too will pass, because these terrible viruses, even if we don't actually come up with the silver bullet to knock them out, they tend to mutate themselves into something that is much less scary. And in fact, the 1918 flu eventually mutated into just the regular flu that we have today. And while we don't want to wait 100 years for that, the bottom line is that, I think that this experience, we're not going to be stuck here forever. We just need to make sure we take care of ourselves. And again, that whole idea of making good decisions is really what's going to safeguard us as individuals and in our communities. And at the end of the day, that's what we want to do.
Yeah, absolutely.
All sound advice.
Thank you. That's very.
Was the vaccine you're referring to Novavax? Are you expecting the next 3 weeks?
I think that the AstraZeneca vaccine is going to wind up being submitted probably within the next month.
Okay.
That's probably the next one in a pipeline. The Novavax will probably be after that one. But the thing that I have been really impressed by is, at least in my home state of Massachusetts, how efficient the vaccination centers actually are.
Mm-hmm.
I was expecting there to be sort of chaos. Remember in the old days, we used to go to a busy airport and trying to get through, security and everything else is like a big mess. But I can tell you, like, it was smooth sailing. And I was really thankful, and I thanked the people who were there because they did such a professional job. And, I personally felt, because, I do believe that people, should have their own right to choose what they think is best for themselves. But on a public health level, what I believe is that, my responsibility to others is to be vaccinated, and it protects me as well. And, but I had this amazing emotional experience when I got vaccinated. And when after my first shot, as well as my second, like it was like this weight lifted off my shoulders. And so, and I've heard this time and time and again from different people. It's sort of like, we didn't realize we were carrying this weight in our shoulders. And when we got vaccinated, like, it was like we stepped over. I felt like I stepped over a line.
Wow. How many weeks ago was your second shot?
About 2 weeks ago. Almost 2 weeks ago. So I'm almost there.
Yay! Wonderful.
Yeah.
Congratulations. Well, I guess I can come stay with you then.
There's room at the inn.
Yay, I love it. I love it. Thank you. Oh my God, this has been amazing. I can't thank you enough for your time, and you've been so supportive of our book. Not only did you give us a wonderful interview for our COVID chapter, you have provided us with friendship and support and advice.
Mentorship.
You've mentored us with the book, and I just, Steve and I are so incredibly in awe of you. We just think the world of you, and we just thank you so much for everything that you've done for the world, for us. We love your book. We can't wait for the next. We'll talk about that on our next Facebook Live with you, I hope. But thank you.
Well, it's my pleasure, and thank you guys for writing the Chronic book. And I really want to encourage anybody who is interested in learning more about my work to come to my website, Dr. William Li, drwilliamli.com. And really, please, if you're interested in learning more about the kinds of things we talked about as it relates to food and health, my online course, Eat to Beat Disease online course, enter a discount code, The Chronic Book, and you'll get a special discount just for the people who are watching this live cast.
Absolutely.
Okay. That's fantastic. So appreciated. Thank you so much for your time. You are one of the busiest people I know, and this has been a really wonderful experience. So thank you again. And we will catch up and maybe do another one in the future.
Thank
Everyone,
you. Looking forward to it.
Have a good night, everybody. Thank you for watching.
Thank you guys
And
so much.
be well.
Bye-bye.
Bye.